Have you ever found yourself wondering, especially after turning 50 or 60, whether masturbation is actually helping your body or quietly working against it? It's a question many men think about, but rarely ask out loud. Some worry that it drains their strength. Others fear it may damage the prostate or reduce sexual performance later in life, and many simply carry years of uncertainty without ever receiving a clear answer. If you've had those thoughts, I want you to know you're far from alone. Every week, I speak with men in their 60s, 70s, and even 80s who bring up this exact concern. Most of them lower their voices before asking, almost as if they're admitting a secret. But there is no reason for embarrassment. This is an important health topic, and it deserves an honest conversation based on science rather than myths. I'm Dr. Rose, a urologist with 9 years of clinical experience helping men protect their urinary and sexual health. Today, I want to walk you through what medical research actually tells us. By the time we finish, you'll understand how masturbation can influence your prostate, erections, hormone balance, emotional well-being, and overall quality of life as you grow older. Some of what you'll hear may surprise you because many of the beliefs people have carried for decades simply aren't supported by modern evidence. So stay with me until the very end, because understanding the truth could completely change the way you think about your body and your health. Before we begin, if you appreciate straightforward medical advice without unnecessary fear or confusion, take a moment to like this video. I'd also love to know where you're watching from, so leave your country or city in the comments below. It's always encouraging to see men from different parts of the world coming together to learn about their health. And if you haven't already, subscribe to the channel so you don't miss our weekly discussions focused on men's health, healthy aging, vitality, and living well for many years to come. Now let's get into today's topic. The first thing I want to make absolutely clear is this. Masturbation is not automatically harmful. At the same time, it is not automatically beneficial either. Like many things in medicine, the effects depend on how it is practiced. Think of it as a tool. A tool can be extremely useful when used correctly, but if it's used carelessly or excessively, it may create problems instead of benefits. That's exactly why this subject often causes so much confusion. For many years, older generations were told that masturbation would weaken the body, reduce masculinity, or even damage the prostate. More recently, some health influencers have gone in the opposite direction, suggesting that it's almost a cure for every male health problem. Neither extreme reflects the complete picture. The truth lies somewhere in the middle, and that's where modern medical research gives us the clearest guidance. Current scientific evidence shows that masturbation may provide several important health benefits for older men when practiced in a balanced and healthy way. However, research also reminds us that there are real risks if it becomes excessive, aggressive, or starts replacing healthy relationships and normal daily life. Understanding both sides is the key to making informed choices. Throughout my years as a urologist, I've had countless conversations with men after their appointments. Once the examination is over and the room becomes quiet, many hesitate for a moment before asking, "Doctor, is it still okay that I masturbate at my age?" Some are 60, others are 70 or even older. What always stands out is not the question itself, but the relief they feel when they realize they can finally discuss it openly without judgment. These conversations matter because masturbation isn't only about sexual pleasure. It also relates to prostate health, blood circulation, erectile function, pelvic muscles, emotional balance, stress levels, and even sleep quality. Unfortunately, many clinics never spend enough time explaining these connections. Today, we're going to have the complete discussion that many men have been waiting years to hear. First, I'll explain 10 scientifically supported benefits that masturbation may offer as men age. After that, we'll carefully go through 10 important risks that every older man should understand. My goal isn't to encourage or discourage the practice. My goal is to help you understand your body so you can make healthy decisions with confidence instead of fear. Knowledge removes uncertainty, and when you understand how your body works, you're much more likely to protect it for the long term. So let's begin with the first benefit, one that many people never realize is happening inside the body. Regular erections play an important role in maintaining the health of the penis itself. You can think of an erection as a form of natural exercise for penile tissue. When blood flows into the corpora cavernosa, the sponge-like chambers inside the penis, those tissues gently expand. That expansion keeps the tissue flexible, improves elasticity, delivers oxygen-rich blood, and nourishes the cells that support healthy erectile function. Without regular erections over long periods of time, these tissues may gradually become less flexible. As elasticity decreases, achieving firm erections may become more difficult with age. In many ways, masturbation serves as a type of physical therapy for the penis by helping maintain healthy blood flow and keeping those tissues active. This doesn't mean it guarantees perfect erectile function forever, but it may help preserve the natural mechanisms your body depends on. As we continue, let's move to the second benefit, and this is one that often surprises my patients because it involves an organ many men don't think about until something goes wrong: the prostate. One of the most respected long-term studies on men's health, conducted by researchers at Harvard, found that men who ejaculated more frequently during adulthood had up to a 33% lower lifetime risk of developing prostate cancer. That number naturally gets people's attention, but it's important to understand why researchers believe this connection exists. The prostate is constantly producing fluid that becomes part of semen. Over time, if those secretions remain inside the gland for long periods, older cells, inflammatory substances, and metabolic waste can accumulate within the tiny ducts of the prostate. Ejaculation acts as the body's natural drainage system. It helps clear out these fluids and allows fresh secretions to replace older ones. You can imagine it like regularly flushing water through a pipe. When water keeps moving, the system stays cleaner. When it remains stagnant, problems become more likely over time. For men over the age of 60, maintaining this natural cleansing process may help reduce congestion inside the prostate and may also lower chronic inflammation, which is one of the factors associated with long-term prostate disease. While ejaculation alone cannot prevent prostate cancer or eliminate every risk, healthy prostate function is certainly one of the reasons many urologists no longer view masturbation as something that should automatically be discouraged. Now let's move to benefit number 3, and this one involves muscles that many people never realize are working during orgasm. The pelvic floor is a group of muscles located beneath the bladder and surrounding important structures involved in urination, erections, and ejaculation. Every time a man reaches orgasm, these muscles contract in a rhythmic pattern. One of the key muscles involved is the pubococcygeus muscle, often referred to as part of the pelvic floor support system. Each contraction functions almost like a brief workout. Just as exercising your legs strengthens your ability to walk, regularly activating the pelvic floor helps maintain the muscles responsible for bladder control and sexual function. For older men, this can become increasingly important because these muscles naturally weaken with age. Stronger pelvic floor muscles may contribute to better urinary control, fewer episodes of leakage, improved erectile support, and greater control during ejaculation. Although pelvic floor exercises such as Kegels remain one of the best ways to strengthen these muscles directly, orgasm also provides another form of natural activation that supports their function over time. Benefit number 4 involves something affecting nearly every older adult today: stress. As we age, life often becomes more complicated rather than simpler. Health concerns begin to appear more frequently. Financial responsibilities may continue into retirement. Family situations change. Children grow older, parents require care, and many men quietly carry emotional burdens they never speak about. All of these situations increase the body's production of cortisol, commonly known as the stress hormone. When cortisol remains elevated for long periods, it can contribute to high blood pressure, weakened immunity, poor sleep, increased inflammation, and even reduced testosterone production. One of the body's natural responses after orgasm is a measurable reduction in cortisol levels. At the same time, the nervous system begins shifting away from a state of tension and moves toward relaxation. This doesn't mean masturbation replaces healthy stress management techniques like exercise, proper sleep, or meaningful relationships. However, when practiced in moderation, it may become one small part of an overall healthy lifestyle that supports emotional well-being and helps the body recover from daily stress. Benefit number 5 is closely connected because orgasm triggers the release of several powerful brain chemicals that influence mood and emotional health. Among them are dopamine, oxytocin, and endorphins. Each one plays a different role, but together they create a noticeable sense of calm, satisfaction, emotional warmth, and mental relaxation. Dopamine activates the brain's reward system, creating feelings of motivation and pleasure. Oxytocin, often called the bonding hormone, promotes feelings of comfort, trust, and emotional security. Endorphins act as the body's natural pain-relieving chemicals while also improving mood. For older men, particularly those who live alone or have experienced the loss of a spouse or partner, this temporary boost in positive neurochemicals may provide meaningful emotional support. While it should never replace genuine human relationships or social connection, it can help reduce feelings of loneliness and contribute to overall psychological well-being when viewed as part of a balanced life. Now let's discuss benefit number 6, which is one of the most practical advantages from a medical perspective. Men who regularly pay attention to their bodies are often the first to notice when something changes. That awareness can become extremely valuable because many serious conditions begin with small physical signs that are easy to overlook. During self-stimulation, a man may discover a lump within the testicle, unusual tenderness, changes in skin texture, new curvature of the penis, or differences in sensitivity that were not present before. These observations should never be ignored. Early detection plays a major role in successfully treating conditions such as testicular cancer, Peyronie's disease, infections, or other urological disorders. I've had patients whose willingness to pay attention to these subtle changes allowed us to diagnose problems at an early stage, when treatment was much simpler and outcomes were significantly better. Sometimes what begins as simple self-awareness becomes the very reason a serious health condition is identified before it progresses. That is why I encourage every man, regardless of age, to become familiar with his own body. The better you know what is normal for you, the easier it becomes to recognize when something deserves medical attention. Pleasure may be one reason for the experience, but awareness is an equally important benefit that should never be underestimated. Benefit number 7 is one that many older men appreciate more than they expect, especially if restful sleep has become harder to achieve over the years. Have you ever noticed that feeling of calm and heaviness after orgasm, when your body naturally wants to relax? That sensation isn't just in your imagination. It's the result of several biological changes happening inside your brain and nervous system. After ejaculation, levels of prolactin rise, oxytocin continues to increase, and cortisol begins to fall. Together, these hormonal changes help shift the body away from alertness and into a more relaxed state. Your heart rate gradually slows down, muscle tension decreases, the mind becomes quieter, making it easier to transition into deeper, more restorative sleep. As men grow older, quality sleep becomes one of the most valuable parts of maintaining good health. Poor sleep has been linked to memory problems, reduced immune function, higher blood pressure, weight gain, diabetes, and even an increased risk of cardiovascular disease. Anything that naturally supports healthy sleep without relying on unnecessary medication deserves attention. While masturbation is certainly not a treatment for chronic insomnia, many men find that when practiced in moderation, it helps their bodies settle into a healthier nighttime routine. Benefit number 8 involves circulation throughout the pelvic region. Most people think only about blood flow to the penis, but healthy circulation extends far beyond that single organ. When sexual arousal and erection occur, blood flow increases throughout the entire pelvic area. This includes the bladder, the prostate, surrounding muscles, connective tissues, and the network of blood vessels that nourish these structures every day. Good circulation is essential because oxygen and nutrients travel through the bloodstream to keep tissues healthy and functioning properly. At the same time, healthy blood flow helps remove waste products and inflammatory substances that may otherwise build up over time. For older men, whose circulation naturally becomes less efficient with age, maintaining regular pelvic blood flow may help reduce congestion, improve tissue health, and support the normal function of several important organs. Think of it as keeping the entire system active rather than allowing it to become stagnant. Although physical exercise remains one of the best ways to improve circulation throughout the body, healthy sexual function also contributes to maintaining blood flow within the pelvic region. Now let's look at benefit number 9, which can be especially valuable for men who struggle with ejaculation occurring sooner than they would like during intimacy. One of the greatest advantages of masturbation is that it provides an opportunity to learn how your body responds without the pressure that sometimes comes with partnered sex. Many men have never truly paid attention to the physical signals their bodies produce just before orgasm. By slowing down and practicing techniques such as the stop-start method, it's possible to recognize those sensations much earlier. The stop-start technique involves stimulating yourself until you feel close to ejaculation, then pausing long enough for that feeling to decrease before beginning again. Over time, this process helps improve awareness, patience, and control. It teaches you to recognize the point where excitement begins to accelerate instead of only noticing it when it's already too late to slow down. With regular practice, many men become more confident in understanding their own sexual responses. That confidence often carries over into intimacy with a partner, making the experience more relaxed and enjoyable for both people. While this technique is not a guaranteed treatment for premature ejaculation, it remains one of the practical behavioral strategies frequently recommended alongside medical evaluation when necessary. Finally, let's talk about benefit number 10, which focuses on something that begins in the brain long before it reaches the body. Many people think of the penis as the primary sexual organ, but in reality, the brain plays the leading role in desire, attraction, and arousal. Every thought, fantasy, memory, and emotional response involved in sexuality begins within the nervous system. By continuing to engage these neural pathways through healthy sexual stimulation, the brain keeps these circuits active. Just like muscles become weaker when they are never used, certain patterns within the brain may gradually become less responsive when desire is completely ignored for long periods. Maintaining healthy sexual interest can help preserve libido as men age. Once sexual desire begins to fade significantly, restoring it often becomes much more difficult than maintaining it in the first place. This doesn't mean every older man should feel pressure to remain sexually active at all times. Every individual is different, and desire naturally changes throughout life. However, remaining connected to your sexuality in a healthy and balanced way may support both emotional well-being and overall quality of life for many years to come. So we've now explored 10 meaningful benefits supported by modern medical understanding. Each one highlights a different aspect of physical or emotional health, from circulation and prostate function to stress relief, sleep, pelvic strength, and maintaining healthy sexual desire. But it's very important to remember one thing. Any tool that offers benefits can also create problems if it's used without balance or awareness. Masturbation is no exception. The goal is not simply to focus on the advantages while ignoring the possible downsides. Responsible health decisions always require looking at both sides of the picture. That's why we're now going to shift our attention toward the potential risks. Understanding these risks doesn't mean you should fear masturbation. Instead, it helps you recognize when a healthy habit may be turning into something that deserves adjustment. Let's begin with the first risk every older man should understand. One of the biggest concerns isn't physical at all. It's social isolation. Masturbation should never become a replacement for genuine human connection. Sexual pleasure and emotional intimacy are not the same thing. If self-pleasure gradually replaces spending time with a partner, building relationships, or maintaining meaningful social connections, loneliness can quietly grow without you even realizing it. Human beings are naturally wired for connection. Conversation, affection, companionship, and emotional closeness all contribute to long-term mental and physical health. When masturbation becomes the only source of comfort or emotional relief, it may encourage withdrawal from the very relationships that help people stay happier and healthier as they age. The healthiest approach is to let masturbation complement your life rather than replace the connections that make life meaningful. Let's continue with the second potential risk, and this one is more physical than many men realize. The skin of the penis is delicate, especially as we grow older. With age, the skin naturally becomes thinner, less elastic, and more vulnerable to irritation. If masturbation is done with excessive force, repeated friction, or without proper lubrication, tiny microscopic tears can develop in the surface of the skin. These small injuries may not always be visible, but they can cause soreness, burning, redness, or lingering discomfort afterward. More importantly, damaged skin creates an opportunity for bacteria and other microorganisms to enter, increasing the risk of irritation or infection. Fortunately, preventing this problem is usually very simple. Use a gentle grip. Avoid unnecessary pressure. If natural lubrication is limited, choose a quality water-based lubricant to reduce friction and protect the skin. Small adjustments like these can make a significant difference in keeping penile tissue healthy over time. Now let's talk about the third risk, which involves the way your brain responds to repeated patterns of stimulation. The human brain is remarkably adaptable. It learns through repetition. If masturbation always follows the exact same routine, using the same grip, the same speed, the same position, or the same type of visual stimulation every single time, the brain may gradually begin to expect only that specific pattern. Over time, this conditioning can reduce sensitivity to more natural forms of intimacy. Some men eventually discover that real-life sexual experiences no longer produce the same level of excitement because their brains have become accustomed to one very specific method of stimulation. This doesn't happen to everyone, but it is something worth understanding. One way to reduce this possibility is by avoiding rigid habits. Allow variety. Avoid becoming dependent on a single routine. Keeping your brain flexible helps preserve a healthy response to different forms of intimacy rather than narrowing its expectations over time. Risk number 4 is especially important because it may delay the diagnosis of a much larger medical problem. Some men notice that they can achieve erections while masturbating but struggle when they are with a partner. Instead of seeking medical advice, they sometimes assume everything is fine simply because erections are still possible in one situation. However, changes in erectile function can sometimes be early warning signs of conditions such as heart disease, diabetes, high blood pressure, poor circulation, or hormonal imbalances, including low testosterone. Performance differences between solo activity and partnered intimacy should never be ignored if they continue over time. Rather than hiding behind the habit, use those changes as valuable information about your health. If erections become noticeably weaker, less frequent, painful, or difficult to maintain, speak with your doctor. Early evaluation often identifies problems long before they become more serious. Risk number 5 is one that many people have never even heard about, yet it deserves attention. It involves body position during masturbation. Many men sit for long periods on hard chairs, lean forward, or remain hunched over while stimulating themselves. Maintaining these positions repeatedly can place pressure on the pudendal nerve, one of the major nerves supplying sensation to the pelvic region. Over time, prolonged compression may contribute to numbness, tingling, discomfort, or even chronic pelvic pain in some individuals. Although this is not extremely common, it's completely avoidable. Whenever possible, choose a comfortable position that supports your body naturally. Lying down or using proper back support reduces unnecessary pressure on the pelvis and allows muscles to remain more relaxed throughout the experience. Taking care of your posture protects not only your nerves, but also your lower back and hips, which become increasingly important as we age. Now let's discuss risk number 6, and this one involves emotional health rather than physical health. Life brings stress to everyone. Some days are filled with frustration, disappointment, loneliness, or boredom. Masturbation can certainly provide temporary relaxation, and there's nothing inherently wrong with that. The concern arises when it becomes the only strategy a person uses to escape difficult emotions. If every stressful situation automatically leads to masturbation instead of addressing the underlying issue, a pattern of emotional dependence may gradually develop. Healthy coping requires balance. Physical exercise helps reduce stress. Meaningful conversations with family or friends provide emotional support. Relaxation techniques, hobbies, spending time outdoors, and maintaining social connections all contribute to emotional resilience. Masturbation can certainly be one healthy outlet, but it should remain just one tool among many, rather than becoming the only way you manage life's challenges. Risk number 7 may be one of the most deeply rooted concerns older men carry throughout their lives. It has nothing to do with biology and everything to do with years of cultural beliefs and personal experiences. Many men grew up hearing that masturbation was shameful, immoral, or somehow damaging to their character. Those messages often remain in the mind long after adulthood, creating guilt even when there is no medical reason to feel ashamed. Persistent guilt can quietly affect self-esteem, confidence, relationships, and emotional well-being. It may even prevent men from asking important health questions because they fear being judged. If these feelings continue to cause emotional distress, speaking with a qualified counselor or therapist who approaches sexual health without judgment can be incredibly helpful. Replacing outdated misconceptions with accurate medical knowledge allows many men to let go of years, sometimes decades, of unnecessary emotional burden. Your health should never be overshadowed by shame that has no scientific foundation. Let's continue with risk number 8, which is something many men overlook because they assume that if a little is beneficial, then more must be even better. Unfortunately, that's not how the body works. Like nearly every healthy activity, moderation is essential. Very frequent masturbation, especially multiple sessions every day over long periods, can sometimes lead to pelvic congestion. Instead of feeling relaxed, some men begin noticing a dull ache, a feeling of heaviness in the testicles, or discomfort deep within the pelvic region. These symptoms are often the body's way of saying it needs time to recover. The solution isn't fear or complete avoidance. It's simply learning to listen to your body. If discomfort appears, allow yourself adequate recovery time before the next session. Your body usually tells you what it needs when you're willing to pay attention. Risk number 9 becomes important for men who are still planning to have children. Although fertility naturally declines with age, many men in their 50s and 60s are still capable of fathering a child. If conception is your goal, ejaculation frequency deserves some consideration. Ejaculating every single day may temporarily reduce sperm concentration because the body has less time to replenish mature sperm between ejaculations. For many couples trying to conceive, allowing approximately 2 to 5 days between ejaculations often provides a healthier sperm concentration. This doesn't mean daily ejaculation causes infertility. It simply means timing can influence sperm count when pregnancy is the objective. If fertility is a concern, discussing your situation with a fertility specialist or urologist is always the best approach. Now let's discuss the 10th and final risk, one that has become increasingly common in today's digital world. The issue isn't masturbation itself. The concern is becoming dependent on unrealistic pornography as the primary source of sexual stimulation. The internet offers endless novelty, exaggerated scenarios, and unrealistic expectations that no real relationship can consistently match. When the brain becomes conditioned to these highly stimulating images over long periods, genuine intimacy with a real partner may begin to feel less exciting. This isn't because something is wrong with your partner. It's because the brain has adapted to unusually intense stimulation. Over time, this may reduce satisfaction during real-life intimacy and create unnecessary distance within relationships. If you choose to use visual material occasionally, try not to become dependent on it. Allow your imagination, emotional connection, affection, and genuine intimacy to remain central parts of your sexual life. Maintaining that balance protects both your relationships and your long-term sexual health. So after looking carefully at both the benefits and the potential risks, the next question becomes very practical. How can you use masturbation in the healthiest possible way? The first principle is finding the right frequency. There isn't one perfect number that applies to every man. Every body is different. Every lifestyle is different. For many healthy older men, somewhere between 2 and 4 times each week provides the benefits we've discussed without placing unnecessary stress on the body. Rather than following someone else's schedule, pay attention to how your own body responds. The second principle is gentleness. Avoid excessive pressure. Avoid aggressive movements. Choose comfortable positions. Whenever necessary, use a quality water-based lubricant to protect the skin and reduce unnecessary friction. The third principle is awareness. Never ignore warning signs. If you notice persistent pain, blood, unusual lumps, significant changes in erections, changes in urination, or anything else that concerns you, don't simply assume it will disappear. Schedule an appointment with your healthcare provider. Early evaluation often prevents much bigger problems later. The fourth principle is integration. Masturbation should be only one part of a healthy and fulfilling life. Continue exercising regularly. Eat nutritious foods. Maintain meaningful friendships. Nurture your relationship if you have a partner. Stay mentally active. Protect your sleep. Your sexual health works best when it's supported by overall physical and emotional wellness. Finally, perhaps the most important principle of all is your mindset. Release unnecessary shame. There is nothing embarrassing about having sexual desire at 60, 70, or even 80 years of age. Growing older does not mean your sexuality suddenly disappears. Desire is a normal part of being human. When approached with maturity, moderation, and self-awareness, masturbation can simply become another aspect of maintaining your body's health, rather than something hidden behind guilt or fear. Gentlemen, I want to leave you with one final thought. Your age does not define your vitality. It does not determine your dignity. And it certainly does not erase your ability to enjoy a healthy, fulfilling life. The goal isn't to judge yourself. The goal is to understand your body well enough to care for it wisely. Masturbation is neither your enemy nor your miracle cure. It is simply a tool. Used responsibly, it may support prostate health, healthy circulation, stress reduction, pelvic function, emotional well-being, and sexual confidence. Used carelessly or excessively, it may quietly create problems that are completely preventable. Knowledge is what allows you to tell the difference. So choose moderation, choose awareness, choose balance. Those simple choices will serve your health far better than fear or misinformation ever could. If today's discussion helped answer questions you've carried for years, I'd love to hear from you. Tell me in the comments what surprised you the most or what topic you'd like me to cover in a future video. Your questions often inspire our next conversations. If you found this information valuable, please support the channel by giving this video a like, subscribing, and turning on notifications so you never miss our weekly discussions about men's health, healthy aging, prostate care, and living with confidence at every stage of life. Thank you for spending this time with me. Take good care of yourself. Stay healthy, stay confident, stay strong, and I'll see you again in the next video. I'm Dr. Rose.